In this video, we're going to be talking about the belly press test, which is one common special test that's used to rule up a subscapularis tear. Now, if we look at the psychometrics here of the belly press test, the sensitivity is poor, all the way down ranging between 34 and 37%. However, the specificity is very good, ranging between 92 and 96%. So based on this range, we can say if somebody has a positive belly press test, there's at least a 92% chance that they have a tear in the subscapularis muscle. The belly press test is pretty simple to perform. The patient will either be standing or seated, and the patient then places their hand on their belly just below the xiphoid process and then presses into their belly. Here's another view of the belly press. What I want you to notice is that my wrist doesn't change angles between before the press and during the press. It pretty much stays roughly neutral the entire time. And that's important because for this test to be valid, you have to watch for compensations that are made by the patient. As I just mentioned during the press, the wrist has to be maintained in a neutral position so that the movement occurs primarily at the shoulder joint, which is where the subscapularis is involved. And so if the wrist flexes a lot like you see right here, the test results are not valid. So the wrist must remain in neutral the entire time. A positive belly press test would be reproduction of the patient's familiar shoulder pain, and most likely you'd have other positive tests performed before this that implicate a rotator cuff pathology.